Welcome to the Food Professor Podcast, presented by Cattle. Season 5, the Baker's Dozen episode. I'm Michael LeBlanc.
And I'm the Food Professor, Sylvain Charlebois.
Our special guest this week recorded live with the three of us at the Coffee Association of Canada's conference last week in booming Markham is Kyle Engelman, Executive Director for Grounds for Health, an amazing organization that's provided women's health programs in coffee communities since 1996, focused on cervical cancer, a nearly 100% treatable disease, and yet in the next 15 years it could kill almost 4.5 million women, 85% of whom live in low-income countries, two of which, we'll hear from Kyle, are the major focus, and of course they're coffee-producing countries, and that's where this all connects. It was an amazing interview. I'd never heard of this program. It's so focused. She is so focused, and they're doing such great work.
Absolutely, and I was so happy that the Coffee Association of Canada decided to create this award to honor groups like that. I mean, that's exactly what we should be doing, and that's how we got to know them, because they were at the coffee conference. Spoke to Kyle, and great story there. I had no idea. Fantastic. They saved so many lives. It's incredible.
So yippee-ki-yay! I think you're still in a part of America that I have come to appreciate. Texas for their barbecue culture. Those who might be watching us on YouTube, I'm wearing a hat from one of my favorite barbecue manufacturers, Millscale, located in lovely Lockhart, Texas, the rib capital of Texas. By the way, not just you, not just me liked Texas. Michelin Guide finally came to Texas and gave accolades to Interstellar in Austin, Goldie's in Fort Worth, Franklin's in Dallas, and Barb's in Lockhart. Now, enough about that. What brings you and where are you in the great state of Texas?
First of all, I've never actually been to Texas other than visiting airports like Houston and Dallas, as most people have in the past. But actually, I'm here to visit some centers, research centers at Texas A&M. And of course, I'm in the Aggie School. And actually, this afternoon, I taught a class. Basically, it's more like a seminar about Canadian food economics and Canadian food policy. It was absolutely incredible. And I actually, to start things off, I actually got the crowd. It was about 150 people. Got the crowd to actually, get in small groups and talk about Canada and just tell me one thing or a couple of things they know about Canada. And it got rowdy a little bit at the very beginning. And I was told, if things get rowdy, just say howdy. And then when I said howdy, you know what happened? Everyone screamed back, howdy. And I went quiet.
It's fantastic.
This is the thing at Texas A&M. Did you know that? I had no idea.
I did know that. And if you want to gather a crowd, this is how you know you've been to Texas a bunch of times when, you hear y'all. But when you say all y'all, that's a sign to the folks there that you've been to Texas more than one time. So you were a guest lecturer as a visiting scholar. And how did it go? What did anybody say? Let's start with that. The feedback from people. What do they know about Canada? It's a big campus, right? I mean, it's a massive university. 150 people come to lecture on ag. Can you imagine?
Absolutely. And of course, it's mostly, there were some PhD students, some master students, but mostly faculty because they wanted to learn more about Canada and what we've been up to. And of course, I mean, the big question was about America's re-election of Trump. I mean, essentially, and they wanted to know how we're seeing this, how we're managing this, and what are some of the things that we're concerned about moving forward, of course. And so most of the discussion was around that. It was great because I was the only Canadian in the room. So surrounded by Americans, and they have their own perspective. And you've been to Texas many times before yourself, Michael. You know that they see things incredibly differently.
Yep. The wonderful people that, a lot of people talk about Texas and whether they have preconceptions, positive, negative, or indifferent, but you go to Texas, meet the people and spend time with them. That's a whole different thing.
They're the nicest people in the world. They're incredibly nice, but there's one thing that so I'm at this hotel called the George. It's on campus. The university itself actually owns hotels. I mean, the stadium is gigantic. They have, by the way, they have stadiums for every sport. They have a stadium for baseball and they have a stadium for softball, because just for baseball is not enough.
Come on.
I
Come
kid
on.
you not.
It's just like Dow, though. Dow's got that, right? I mean, it's just like Dow. So
sure, absolutely. But the one thing that this hotel is really interesting because they have white sheeps everywhere, but they move around. They move around. Sometimes you actually walk into a lever and there's a white sheep there. You go, whoa, wait.
Oh, what's going on?
Those sheeps? And they're everywhere. And so sometimes you actually get out of your room, your bedroom, your hotel room, and there's a sheep right there.
Now, how long are you there for? We recorded this on Wednesday, and
we're leaving Friday.
Leaving Friday. So spending a bit of extra time, just checking out. It's a good opportunity when you get there, right? Fantastic.
Oh, absolutely. And so tomorrow it's more time on campus. I'm actually visiting a animal science research center, and then I'm going to plant science as well. And I'll be finishing my tour on campus, visiting the group in food science. I'm really looking forward to that. And I mean, Texas A&M is one of the top ranked ag schools in the world. So and you can tell. You can tell. It's just incredible. Yeah, lots of things going on.
There's a level of interest that I hear for the number of people who had showed up to hear a Canadian talk about ag. 150 people. It's fantastic. All right. Well, let's get into the news, and it's a good kind of segue. Much talk obviously around America here in Canada, and trying to figure out where we sit, and we're going to talk about a few items in this episode now. My mind turns to Trump, and as we think about Trump and, as Biden wanders off into the Amazon forest, we've seen a flurry of appointments from the incoming administration. And I'm not going to go through them. We're not a political podcast, but have you seen any that impact Canadian ag that we should be aware of yet? I haven't seen any, so maybe that's pending. But any early thoughts, or did you catch anything when you were down there about... So they haven't, and I haven't seen this, they haven't appointed their head of agriculture or farming yet in the Trump administration. I've seen a bunch of other appointments, but I haven't seen
as we're recording this, I haven't heard. Of course, there's been a lot of appointments around health with RFK, and I believe Dr. Oz was also appointed to lead health.
What a cast of characters. But, that we'll leave that for the Americans to figure out. Yeah, that
was, we did talk about RFK's appointment here today in Texas, and also Dr. Oz. I don't think there's many fans here, to be honest. It's just they're seen as controversial, and frankly, they're not entirely convinced that both will stick around for a while. And frankly, when I look at some of the things that are being proposed by both, especially RFK, I don't see how this is going to end well at all for the administration. My guess is that RFK will probably stick around for maybe a year, if not less. This is going to be because we're talking about tackling oil seeds, nutrition. You got to be hitting hard publicly traded companies, and Trump is a stock market happy president. I'm not entirely convinced that there's going to be appetite, no pun, to actually start hitting hard on some of the companies out there.
Well, we'll watch and see. We'll wait and see what happens. You were on TV Ontario's The Agenda with one of the greatest journalists in interviews in Canada, by the way, Steve Paikin. You talked about... by the way, if you're listening and you're a Steve Paikin fan, he's got a fantastic book on John Turner, so pick that up. Now, the panel was about monopoly power in the food business. A successful panel as it brought into the discussion seeds, fertilizer, not just grocers, but it did talk about, you brought it up, property limitations. Now, our recent guest, Per Bank from Loblaw, had offered if the other four players agree to waive those, and it seems that Manitoba today, Wednesday, is a step ahead of all of it, passing some kind of rules or legislation. What did you notice when you were down in Texas, up in Manitoba?
Well, actually, I did get a phone call from some people I know in Manitoba informing me of the Tronan speech. in Manitoba and thought that it was good news. I mean, Loblaw itself, with Pierre Bank, did acknowledge that it's common practice in the industry. And frankly, I don't know why this exists. If you're out there competing, compete, fairly. Just make sure that you compete fairly. If you want customers, offer them value. And that's what it's all about. That's what capitalism is all about. Don't suppress competition. I mean, that's just not
but
how it should be.
Don't you think, though, let's talk about that for a sec. Don't you think, though, that the landlords who would want to compete for dollars from the Big Five would just offer it? Like, if it was ruled askew somehow, if you cast your mind to the future and they're all competing for the next space, wouldn't you think they'd just offer it anyway?
Oh, probably. Yeah, absolutely. But I don't think it's right. It's common practice. It's part. That's why I've always believed that there is a culture in the food industry that allows these things to happen. But I don't think we need to accept them at all. I mean, I'm in Texas right now. It's a free market. Okay. Don't design how the competition should look like for you. You compete, you're out there, and that's how it goes. Some people win, some people lose. And that's how it should be in Canada as well. I've never been comfortable with property controls ever. And I just don't think it's because some tenants will have more power than others. And frankly, this is about geography. And geography is a big challenge in Canada. And I'm from a small town. Okay, in Quebec, and there was just one strip mall. Well, you call it a strip mall. It was very, very small, and I can tell that the grocers that were in my town really control the geography of Farnham, Quebec, of who actually was selling what. I could tell. I didn't know at the time, but now today, reflecting on what was going on, I can tell that there were a lot of property controls that really shouldn't have been there. And that tends to push prices higher. And people need to know that. At least what Manitoba has done now was to actually bring this topic out there, and people can judge. Maybe Canadians don't care. Maybe they don't, because they don't know it exists. They don't even know what it is. So now, and I spoke about it on the agenda on Monday, but I was honestly, I have to give a lot of credit to Loblaw, because they're the ones saying, you know what, it's a problem. We want to stop doing it, but we hope that everyone stops, which means create a level playing field for everyone. That's what Manitoba's doing.
Let's talk about Mexico and agriculture. Ontario's Premier Doug Ford, who is taking a national leadership role, nature abhors a vacuum here, on this with fellow premiers, is saying basically we need to blow up CUSMA and have separate trade deals with the U.S. and Mexico to head off trouble with the states, headed off at the pass, so to speak. So let's have a listen to what Premier Ford said today.
We just got off the phone with all the premiers, and there's a clear consensus that everyone agrees that we need a bilateral trade deal with the U.S. and a separate bilateral trade deal with Mexico. We've asked for a meeting. We will be asking for a meeting with the Prime Minister and his representatives to make sure that we're all on side. Another great consensus is it's all about Team Canada. We're going to take that approach, and we're going to sit down and have a great strategy moving forward. And it's nice to get all the premiers together for the first time and congratulate it.
So let's talk about Canadian ag and Mexico. I mean, I love my avocados and chiles, and well, what's at stake here? What do we trade with? I think of auto parts in Mexico, but let's talk about ag, of course, because we're an ag show. What do we trade to Mexico, and what do we source from our friends in Mexico?
Yeah, so multilateral deals are very difficult, and of course, the whole idea was to counter the EU, and that is also challenging. It lost the UK recently, and you can tell that things aren't necessarily working all that well. It's the same in North America. I do wonder what's going on in Doug Ford's head. We are Canada. We are just a state in a grand scheme of things. Do Americans care? That's my question. And like I said, I'm in Texas here. I mean, I had to explain where Canada was for a while on campus today. I'm being a little silly here, but I mean, at the end of the day, I mean, Mexico matters way more to Americans than Canada, because Canada is just a foregone conclusion. We're dependent on the U.S.
I think what Ford is saying is, let's, in knowing what you say, that America is going to focus more on Mexico, let's get out of the way, do our own trade deal with them, and not get caught up in it, and do our own separate deal that suits us better. I can't imagine Mexico is a big buyer of Canadian ag. I mean, we probably source more from them.
We buy more from them than they buy from us. Yeah, absolutely. Yeah. Okay. But we sell we do sell some commodities to them, but a lot of it goes through the U.S. To your point, like from a trade perspective, losing Mexico, does it matter? But I've always seen the United States, Mexico, Canadian trade deal as a trifecta, and I'm not sure there's any interest in establishing a trade deal like that without Mexico from an American perspective. Maybe from a Canadian perspective, but I don't see why America would actually would do all this work only to settle a pact with Canada. I mean,
well, it would be something we would want. You're right. It'd be something we would want, because our wage structure is much closer to the U.S. than it is to Mexico. But
here's the other concern that I have, is that we actually have deals with the Trans-Pacific market and also with Europe, and I can tell that Canada is actually in a very, very good spot, having 3 major continental deals. And I know that some companies are taking advantage of that, using Canada as a portal into the American and Mexico market. And so if you lose Mexico, you lose that advantage as well.
Well, let's keep a close eye on that. Let's take a break now. First of all, let's hear from our fantastic sponsor, Kettle, and then we'll get to our interview with Kyle from Grounds for Health, and then we'll come back and talk about carrots. Does your digital customer engagement strategy need a serious upgrade? Enter Kettle, Canada's consumer insights powerhouse with the largest, most active panel of everyday shoppers. They're not your typical sponsor. They're the voice of the consumer, always in the know on the hottest trends and shaping what's next. So why Kettle? They go beyond consumer insights. They're trailblazing the future of ratings and reviews and leading the charge in user-generated content with unmatched syndicated receipt data and the ability to gather reviews across any category. Kettle partners with giants like Walmart, Canadian Tire to deliver results that count. Visit AskKettle.com now for an exclusive The Food Professor podcast listener discount on your first review or research campaign today. That's AskKettle.com. Kyle, welcome to the Food Professor podcast. How are you?
I'm great. Thank you for having me.
So great to meet you. We're here at the Coffee Association of Canada's conference up north of Toronto, and you're the benefactor. You're the star. There's so much interest and buzz about what you're doing. I mean, Tony was talking about how impressed he was about your organization. So it's really great to meet you. Thanks for spending time with us.
Wonderful to be here, and we've had an incredible reception, like you mentioned.
Fantastic.
So you are the first ever award-winning charity at the conference. Congratulations.
Thank you.
And of course, I was listening to your speech, your presentation, and I have to admit, I didn't know much about your organization, but as you were talking, that's when I understood why you won.
Right. So, thank you.
Oh, yeah. So congratulations. Could you tell us more about what you do?
Yes, absolutely. Okay. So we are a women's health organization. Our mission is to prevent cervical cancer in coffee communities. It sounds really specific and very focused, but really at the end of the day, what it's about is keeping women healthy, who are the farmers and the backbone of the coffee industry. These are women who, they're picking coffee beans, they're sorting the beans, they're taking care of their families, they're taking care of their communities, and we wouldn't have a cup of coffee in the morning if it weren't for these women and for the farmers. And because they live in really remote places, coffee is grown in mountainous regions, in rural areas across Latin America, Africa, Southeast Asia. Because they live in these hard-to-reach places, they often don't have access to basic health care. That's right. So there aren't providers who are trained to give them a basic women's health exam, things that we all
take for granted, right?
That's right. That's right. You know, I just grew up knowing that as a woman, I would have an annual exam every year. Call your OB, go on in, get your exam. I don't even know if I knew why or what they were taking care of, but what they were doing was they were looking for signs of precancer.
Yeah, once in a while you got to go visit your...
That's right.
Yeah.
That's right. And we had access and we had follow-up, and these are things they don't have. So that's why we're there.
The one question I have is, so you've clearly aimed at cervical cancer.
Yes.
So we know why. I mean, but do you think it may actually get people to just think that you're very specific or too specific health-wise for women's health?
Yeah, we're intentionally specific. Cervical cancer itself is a preventable disease. It's one of the few preventable premature causes of death. And so when you think about sustainable development goals, talk about let's prevent premature deaths. Well, if you want to do that, cervical cancer is the number one way to do it for women in low and middle income countries. So first
you mentioned in your presentation that there's one woman every 2 minutes
who's dying from cervical cancer. That's right. That's right. At this point, women dying from cervical cancer actually outpaces women dying during childbirth and afterwards. So that's obviously a global health issue that we're all aware of, that resonates with all of us. Cervical cancer is now killing more women than that. So part of why we're specific is because it's such a solvable problem. It's literally something that we could say we took care of in our lifetime.
Do you have any idea of how many women's lives you've saved so far? I mean, I put you on a spot here, but...
No, it's a great question. I mean, we've screened over 230,000 women.
Wow. Okay.
The actual lives saves comes down to the number we've treated. And so we've treated probably over 10% of those women, probably over 25,000 women. Those were women who had evidence of pre-cancer. So had our programs not been there, had the providers there not intervened, those 25,000 women might have gone on to develop cancer.
So you've likely saved 25,000 lives.
Isn't that beautiful?
Wow.
Amazing.
Yeah.
Amazing.
Yeah. But we're also focused because we can be really good at what we do. We can be really efficient and really effective. A lot of organizations, when you take on too much, we call it mission creep, we call it resource creep, whatever you want to do, right? But, we are working constantly at having the most innovative, the most cost-effective, the most efficient model to get to these women. So that's part of why we keep it so focused.
So tell us more about your daily work.
Yeah.
Like a day in your life. How does it look like? Do you fly around all over the world? And, how does that?
How many frequent flyer miles do you have?
I know.
Yeah.
There was a period. So I started as program director at Grounds for Health, and there was a period of time I was traveling more than 50% of the time.
Yikes.
I knew I could, if I had missed a flight at any airport, I could go up to customer service and say, well, this airline will get me here than there, but this one will get me to and I could tell them exactly how to reroute me. Life as the executive director is a little different, but I'll tell you about the team. We have 8 staff in Ethiopia and Kenya, which are the countries where we currently have active ongoing programs. They're from there. They're from the local communities. They speak the local language. I mean, in Ethiopia, these staff, they speak English, but they also speak Amharic, which is the national language, but they also speak Sidamia, which is the language in the Sidama region, which everybody in coffee knows because you've probably seen Sidama on a coffee bag.
Yeah.
So we have local staff who are from these communities. They know exactly how to speak to women, men, farmers, families, healthcare providers about what it is we do. We do capacity building, so we're training healthcare providers, we're training community educators, and then we're basically taking the supply and demand and putting the two together. We're saying, okay, we've got healthcare providers who now know how to do these screenings. We've got women who now know how important it is to get these screenings. Let's go run a campaign. Let's get them all together. Let's make it happen. Let's get those numbers up. So that's really the day-to-day. In my job, I have to try to find donors and I have to talk about the impact of our work.
Go on podcasts.
That's right.
So
and I got to check the finances and all of that. But really the day-to-day is the community level work.
How did you find out that you won the award?
Gosh, there was an open call. We knew the award was something that you could submit for. And so we did, in fact, reach out to some of our friends and say, hey, would you mind submitting on our behalf? Yeah. And then I think it was, I can't remember if it was just an email or, but
were you surprised?
I was honored. Yeah. We have there are a couple companies here that are just decades-long supporters, and it really meant something. One of our board members is Adam Pesci of Reunion Coffee.
Oh, yeah.
And he said that in the room...
Who actually won an award today as well.
That's right. Yeah. That's right. But he said that in the room, he couldn't raise his hand fast enough to be the sponsor of us for this award. So one of the companies, Mother Parkers, ended up being the sponsor this year.
Yeah.
And so that was so validating.
Yeah.
But really, I think the length of partnership is the validating thing. The awards are lovely. This opportunity is incredible for our organization. But it's the fact that donors year after year just keep supporting this cause. That's the true partnership.
Your fundraising strategy, how does it look like? Do you have campaigns? Do you have a special day? Do you sell cookies? How do you raise money for your cause?
Yeah, we have an amazing team. A lot of it is relationship building. It's getting to know these companies. It's getting to know their priorities. It's getting to know which ones are really have it built into their brand or built into their mission or built into their coffee sourcing that they take care of women and farmers. So a lot of it is relationship building, coming to coffee trade shows, being introduced to people through other partners throughout the industry. We have a really exciting initiative we're starting. Last year was our first year, but on International Women's Day, coffee roasters and retailers can sign up. They register for what we're calling Grounds for Health Week. We send them all the marketing materials for front of shop. They run a fundraiser over the week of International Women's Day. The money comes back to them, but they also get to engage consumers. They get to stand up for
That's right.
It's fantastic.
It makes
values.
the chain very transparent.
That's right.
Yeah.
That's right. So that's an exciting one for the roaster retailer side. On the more corporate side, it's really about relationships.
So let's talk about you. How did you get into this line of work? Were you always, publicly minded? Were you talk about, how you found yourself doing this kind of line of work, let alone the organization?
Yeah, thank you. My first trip to Guatemala, I was 17 years old, and there was a family I was working with when I was in Guatemala that I was staying with, getting to know, and the woman got really sick. And it was striking to me how hard it was for her to have the time, let alone the access to health care. So that kick-started me I ended up going to undergrad, being pre-medical, went on and got my master's in public health and my nursing degree. I'd always focused on global women's health. So I've done initiatives in Nigeria for maternal health and for girls' education and empowerment. I've done programming in Latin America. I found my way to Grounds for Health partially because, the model, the mission, it really resonated. Also, the way Grounds for Health does our work, there's so much integrity to how we do this work.
What an interesting background, because you've got both the health science, the public policy piece, and now you found an organization that, we often talk to people, entrepreneurs or innovators, where the personal and the professional kind of intersect. Right. And then that creates this kind of multiplying power of what you do, right?
Yeah. Well, and let me add one more thing that I love about what I do. When I was getting my master's in public health, I also was going off into the business school and taking business classes and learning about social impact. How can we quantify that in a way that makes sense across the public and the private sectors? And when I found Grounds for Health and I learned that we do this healthcare work, which is what my training and my passion is in, we do it globally, but we do it in partnership with the coffee industry. That spoke to me of an opportunity and a legacy that could be sustained much more than just on charitable dollars or just on federal grants. So it was really amazing, actually. It felt like serendipity coming out of grad school for me to find this organization.
What part of the world are you from?
I grew up in New Jersey, and then I made my way out west for a while, and then I was trying to come back to New England, and Grounds for Health is based out of Vermont. So that's what brought me back. And it's kind of a dream to get to live in a rural, mountainous, community-minded part of the world, part of the U.S., and do this work globally.
So I guess the last question for me, I'll pass the mic back to Sylvain, is if you had, amongst our listeners would be a number of different types of people, what do people mostly get wrong about your type of work, about helping the communities? What is it that you'd like to say? Listen, if your assumption is this, here's what we do, and here's what our industry or our group of people do that might surprise you.
Great question. One thing we talk about a lot is how a lot of international aid organizations, if we want to call them that, they take this approach of, let's take care of the poor farmer who, doesn't have any money or doesn't have access to food, or the starving children in Africa. And we work really hard as an organization to make sure that women are seen as the empowered, capable, brilliant people that they are, regardless of where they live. So I think that's something I would say, which is, we do this because we believe in a global community that we're all completely interconnected and interrelated, and that it's as important to take care of a woman in Ethiopia as it is to take care of a woman in Canada or in the United States, because we live in a global economy. We live in a globalized world. We live in a place where we all need each other. We don't do it because of, the poor farmer. We do it because we're comrades and we're community members together.
Yeah, and I think what's working for you is that you're making the problem pretty obvious. I mean, it's very targeted. Instead of just raising money for the poor, you're basically saying this is the problem and we need help.
Yes.
Yeah.
And in a perfect world, we put ourselves out of work. Yep. Right. So there are vaccines nowadays that if we can get universal coverage of the HPV vaccine among girls and boys, there are literally only 2 decades of women who are at this point too old for the vaccine to be effective. They're the only women we need to screen and treat. If we do that in the next 30 to 40 years alongside vaccination campaigns, we're done, right? Just like polio. Polio doesn't exist anymore because we did extensive vaccination and we took care of anybody who was sick. So, it's so targeted, and ideally it's something we can solve in our lifetime. How cool would that be?
Exactly. Last question for you. So what's next for Grounds for Health? What's for the next 5 years? Like, what do you hope to achieve?
Yeah. So I spoke in my talk a little bit about the HPV self-sampling, and this is actually a technology. It's relatively new. We're just starting to use it in the U.S. I don't know if you're using it yet here in Canada. It's where women can test themselves for the virus that causes cervical cancer.
Okay.
It's going to give so much freedom, so much autonomy to women. It's also less of a burden on the healthcare system, right? So that's what's next for us. We've started piloting it. We're going full force this year. We want to reach...
Is this technology costly?
It is more expensive. And we are saying that we provide the best healthcare possible to women no matter where they live, and for that reason we have to go full force ahead with this. It's better for women, but it's also a higher clinical tool, a higher quality tool. So in the next 5 years, what I would love to see is that even though it's more costly, we come up with all the different models where we can use this tool and this innovation to get more effective, more efficient with it, and maybe even have models where it's a lot easier to expand to new geographies, to expand to new partners, to expand to new industries, even to reach women and to increase our impact with the tool.
Again, congratulations
Thank you.
On your award, and on behalf of myself and Michael, thank you for joining us on our show.
Oh, thank you for having me.
Now, if people want to get a hold of you,
yes,
where do they reach out, and websites, and learn more about the organization, donate, get involved?
Yeah, so please read more. Our website is groundsforhealth.org. It's all written out. We're also on Instagram, LinkedIn, Facebook, your standard social media. And we have tons of information, beautiful pictures, updates from the field, and
Wonderful.
You can learn all about our staff and our team there as well.
Are you a LinkedIn person? How do you get in touch with you?
I am on LinkedIn, yes.
Right. Very good.
Yeah.
Excellent. Thank you so much.
Yeah.
you sent me this note, and I've been watching this, and you described it as a bizarre recall. What's going on with baby carrots? Because, it's another E. coli outbreak. What's going on?
That's
Tell
right.
the people.
Well, it's I believe it is food recall number 144 this year so far, and a lot of people are asking me, is it a record? Are we seeing more recalls? Not really. The record is actually 253 back in 2021, so we're very far from the record. It's just, I think what's going on right now this year is that we're hearing more about recalls because recalls are impacting highly consumed products like carrots, for example. But in this case, we're talking about organic carrots coming from the largest carrot farm in the world. So you and I have eaten carrots from that farm. And what I find, so first of all, it's E. coli.
Where is this farm?
So
Where is this? Where is this farm?
So it's in California, and we're seeing more cases of E. coli coming out of California because a lot of farms have to go farther to get water to irrigate their fields, and of course, by doing so, they often do that by getting water that is contaminated from livestock that are nearby. That's nearby. And so the onions at McDonald's, that case was exactly the same thing out of Fresno, California, same case. But here's the deal. Here's the one thing I don't understand here. So on November 16th, the Center for Disease Control sends out a memo. So it's a recall in the U.S., but in that memo is mentioned Canadian brands, Compliments, and President's Choice. And the CFIA didn't send anything until November 18th, 2 days later. So for 2 days, we had these contaminated products available to Canadians without any recalls at all. And I don't understand why, honestly.
Now,
it's the first time I've ever seen an American CDC, the American CDC, recalling Canadian brands before the CFIA. And who touted the recall? Media in Canada. They're the ones that actually, because the CTV News actually called me on Monday saying, "Oh, I'd like to interview about the baby carrot recall." I said, "What recall?
What
the recall is going on? There is no recall in Canada. What do you mean? Go on the CFI website. Good luck. There was nothing. It came out that night. So I do wonder what happened there.
Interesting. And it would be interesting, we'd have to know this from the grocers, but the grocers are equal to or sometimes greater ahead than the CFIA. If they know that, they would pull them from the shelves, I would think. That's Sobeys. So they would, the vendor would call Sobeys and say, take this stuff off the shelf, right? I mean, they wouldn't wait till the CFIA to tell them.
Probably,
right?
But people have bought those products, and those products are in people's homes.
That's true. That's where Sobeys can use their great program to reach out. I remember Loblaws did that.
And that's what's key here.
We see you bought that.
I think we need to. I mean, so I've always argued that we shouldn't rely on the media to convey to communicate risk to the public because media is busy, and right now we're seeing a very strained media, lots of layoffs and stuff. They don't necessarily have time, depending of the cycle. So we need to figure out ways to communicate with them. But this time, they're the ones that actually made the recall happen, which is interesting. Oh, yeah, absolutely.
Bizarre. And let's talk about some other news that came out in Canada, the CPI and inflation numbers. And I saw the same thing you did. They don't look like they're going in the right direction. And again, it looks like they popped up a little bit, and some of it looks domestic inflation, particularly in food. What did you see? What were your thoughts?
Disappointed, but not necessarily surprised, because you're seeing costs are going up again. And so obviously at some point, grocers have to make their margins. But here's the thing here. And before people actually start blaming Gill and Weston for whatever's going on there at the grocery store, you may want to look at what categories are pushing food inflation higher. And the answer is basically simple. Food categories which rely on domestic production are the ones responsible for a higher food inflation rate right now. So dairy, meat, and vegetables in the fall, because those numbers are from October. In October, you do have a lot of vegetables coming from
The harvest,
from Canada.
harvest. Yep.
Exactly.
Yep.
And so those are the items. So in other words, imports are saving us. Imports are actually helping us, but the dollar is falling. And so I don't know about you, Michael, but I'm getting a little nervous here.
Yeah. We could see a sub 70-cent dollar on the horizon, right?
Absolutely. And a lot of analysts actually have said that. And so I'm very concerned about what's going on here with the CPI. And so on December 5th, of course, we're releasing Canada's food price report. And so be on the lookout, folks. I'm not sure 2025 is going to be as easy as 2024, unfortunately.
Interesting. Now, one positive note came out in the industry this week. Olive oil might drop like 50%, which still wouldn't make it cheaper because it's like rocketed up like 100+%. But is this finally we've had good harvests in Spain and Portugal? Is that what's driving this? In Greece?
Well, wholesale olive oil prices have gone down 22% over the last month. Okay. And we need to broadcast this as much as possible because people need to know that olive oil is costing less, not more. And so will prices drop, or will retailers keep their margins, or so that's the thing. But
of course what's on the shelf today they would have bought 6 months ago, so this isn't an overnight thing.
But harvest in 2020, they're expecting a strong harvest out of Spain in 2024 and 2025. So sometimes things go bad with climate, but sometimes things work out. And so I guess of course, clearly olive oil will either be as expensive or less expensive over the next 6 months.
All right. Well, that's good news. I feel like I got more to say, but I feel like we should end the episode on good news. But I got a couple of things, both of which aren't bad. I want to shout out to McDonald's. They put forward a $100 million campaign to get folks back into the restaurants after their bad onion crisis. We talked about that earlier. And for what looks like the product placement pick of the year on Trump's private jet with a cast of characters enduring fries and Mac, including Elon Musk, the head of Doge, and Health Czar Kennedy.
America healthy again.
And, of course, number 47 himself. Never touched alcohol, that boy, but he does like his McDonald's. So congratulations to McDonald's. And by the way, last but not least, shout out to the Argos who bested the Winnipeg Blue Bombers in the 111th Grey Cup in rainy Vancouver. If you've been paying any attention, if you've seen the news, they're in some kind of weather bomb again. They're getting pummeled with precipitation, but didn't matter. Let's go Argos and CFL win.
Well, if BC Place didn't have a roof, Wimps out of Toronto would have lost.
Yeah, oh, nice. I think it would have been a game of water polo is what I think it would have been. Based on the weather. I was there last week and it was rainy. So anyway, listen, that's a wrap on this episode. Lots of stuff we covered end to end. And listen, I want to wish you safe travels back from the great state of Texas. I'm Michael LeBlanc, media entrepreneur and podcast host and keynote speaker and a bunch of other things. And you are?
I'm the food professor, Sylvain Charlebois.
Safe travels, everybody.
Take care.